Good afternoon. How is everyone doing today? I see, we have some improvement, but let me guess, you all went this morning 7 a.m. for a run, right? Had some healthy breakfast, some superfood, some yoga, chill, right? Get down the stress from the week. Or maybe we have just all been on the couch, right? Enjoying some our TV time, our favorite series. Whatever it is, I would say the fact that we managed to meet here today in the room, on the side or online means we're not doing too bad. Everyone evaluated her or his health state as kind of okay, ready to talk about SDG 3, health and well-being, right? That's good because I would like you to think one moment with me about the following question. What do you think a car-sharing company, a food delivery company, and a hotel chain have in common? It's not getting a Q&A session. I just want you to think with me a second about that. Because now I'm giving you my perspective on this. For me and my workplace, they were all part of the joint fight of the COVID-19 pandemic in the initial days. Before we get into this, let me take you back a moment to March 2020. It was around that time when the first wave of COVID was hitting the world, spreading across countries, across continents, and we were all fearing great uncertainty. We didn't know what was going to happen. What did that mean to us as a person, to us as a society, for the world, how we knew it? And it was the time also where I get this call from my workplace, right? And they're like, Nina, we keep on getting these emails and calls of companies and people that offer us their help. They want to provide us with their products and services to help us fighting this pandemic. We don't know exactly what we should do with that, if we can make use of it, but it should be somehow coordinated because it's just keeping on going. Would you be available? Why not, right? Okay. What I should mention at that point, the place that I'm talking about was a university hospital, a place that focuses on patients, that focuses on research, a place that should soon become also one of the main actors within these crisis times. Not exactly sure what I was agreeing about and what we're going to face. These calls and emails were just coming in like all over the company, and it was chaos. Because on the one hand, it was clear that we were in a new situation. There were new issues coming up every day, new demands, new needs. And on the other side, there were all these great ideas of how to help us, how people could support us. We decided to get a small team together from internal people that were from different departments, purchasing, the healthcare part, the HR, many people, different departments. And that was because we wanted to try in fast time also understand what are the needs in these departments, what are their daily operations, what do they need? And we had all these bits and pieces in front of us that were just not adding up at all. And we decided probably from what we were seeing in that short time, the best thing we can do is develop a platform, like very simple, very fundamental, that allowed to channel the communication from the people who were offering to the people that were in need. And by this, all of a sudden, things started to make sense. They were used oftentimes in very different ways than you would usually expect, but by simply, let's say, reframing the purpose of a certain product or service, they were all of a sudden useful in a hospital. And with this, all of a sudden, a car-sharing company was not longer offering us a car. What they were offering was a safe zone, how people could commute to work, to the hospital. A food delivery company was all of a sudden the provider, sometimes the only one, of healthy nutrition to get through the day. While everything was shut down, the hospital was highly restricted in access. So these very simple things become all of a sudden very challenging. Or the hotels were offering rooms for doctors and nurses so that they were not exposing their families to risk. By now, you're probably still wondering, and what exactly is it that this has to do with the SDG 3, health and well-being? Because at the end, this is about people, it's about being healthy, avoiding diseases, isn't it? I want you to invite to watch these pictures. This is a tweet that we did back then to thank the supporters. You see when these offers of help were arriving in the hospital to the people. Many different things, it's just a few of them. But as random as flowers, food, bikes. And the tweet says, these offers support us to focus on the essential. To focus on the essential meant in that case, even if it was just a tiny bit, but these things that were coming to us from external were helping the people working in the hospital to focus on their essential skills, to help people, to reduce their everyday hassle, easy things like how do I get to work, how do I eat? And if it was just something small like a chocolate bar or a coffee that was causing a smile during these really, really harsh times. So in the end, all these initially very random seeming offers were indeed helping people to get back on their feet, just in a very, very different way as we would expect. My personal learning from that period is that health and well-being is much more, goes beyond medicine, it goes beyond the individual health state of a person. I asked you at the beginning, how are you feeling? Implying by this that by focusing on our own health, it kind of means we are good as a group, good as a society. However, what this really taught me is it's much more about a highly complex system, the health of this system, which might require much more than the conventional definition of health might be. In fact, if you look up the definition of health, it really depends on the language you're reading, the description, what it actually means, because it's not so simple. I suggest look it up and you will see a difference. So it really depends on the perspective of what it is when we speak about health. In the end, what we observed during these times was that the success in coping with the current crisis, and very likely also with future challenges, depends on our ability to work together, to collaborate across departments, across companies, across entire business areas. It will not just depend on our joint responsibility, but on our joint responsibility. Everyone can support health. What's your contribution? Thank you very much.